The video we are going to discuss about the Brown sequard syndrome. This is the frequently asked short notes from the central nervous system. Brown sequard syndrome, otherwise called as the Hemi section of the spinal cord. So this is the structure of the spinal cord. During the injury and accident, suppose the only one side of the spinal cord is affected, that is called as the Hemi section of the spinal cord, that will produce the Brown sequard syndrome. Okay, so here the tracts, this is the spinothalamic tract, this is the blue color is the dorsal column pathway, this is the pyramidal tract. Here is the lesion, Hemi section of the spinal cord. Before discuss the clinical features of the Brown sequard syndrome, we should know what are the sensations carried by the dorsal column pathway and spinothalamic pathway. This is the dorsal column pathway. It carries the fine touch, vibration, stereognosis, proprioception, tactile localization, 2-point discrimination. So first order neuron from the receptor to the dorsal column of the spinal cord reach the medulla, crosses to the opposite side, reaches the thalamus. Third order neuron supplies to the sensory cortex. The spinothalamic tract, it carries the crude touch, pain, temperature. Here the first order neuron is end at the spinal cord. Second order neuron crosses the spinal cord. At the level of the spinal cord, crosses to the opposite side and reaches the thalamus. Third order neuron start from the thalamus to the somatosensory cortex. Clinical features of the Brown sequard syndrome. So this is the lesion, Hemi section of the spinal cord. Below the level of lesion, the same side. So the lesion is here. The same side. What are the sensations lost? Fine touch, tactile localization, tactile discrimination, vibration, proprioception, stereognosis. Fine touch is a touch. Tactile localization is the ability to localize the point. Tactile discrimination is ability to discriminate the 2 point is separate. Vibration, you know. Proprioception is the conscious sensation of the movement, kinesthetic sensation. Stereognosis is the ability to identify the familiar object with the closed eyes by size and shape and texture of the object. Okay, so these sensation carried by the dorsal column pathway. This is the blue color is the dorsal column pathway. So same side the dorsal column pathway is affected, so it will lose the dorsal column sensations. Below the level of the lesion, same side, what are the sensations not affected? Crude touch, pain, temperature. So the spinothalamic tract, so here it travel to the opposite side. Okay, so from this side to travel to the opposite side, so it will not affect it. The spinothalamic tract carries the crude touch, pain, temperature. So these sensations not affected in the Brown sequard syndrome below the level of the lesion. The motor changes. It increases the muscle tone, spasticity is produced, and deep reflex is exaggerated. Babinski sign is positive. If you strike the plantar aspect of the sole from the heel to big toe. The curved pattern, it will produce the plantar extensor, that is Babinski sign. It is one of the important features of upper motor neuron lesion. Superficial reflexes lost. So all the motor changes are similar to the upper motor neuron lesion. Deep blood pressure decreases the blood pressure. Okay. So the below the level of the lesion, the same side, motor changes are prominent than the sensory changes. Below the level of lesion, opposite side, crude touch, pain, temperature sensation is lost. So opposite side, the spinothalamic tract come into this place. So opposite side, the sensation is below the level of lesion, spinothalamic tract sensation lost. Not affected sensations are dorsal column sensations below the level of lesion. The opposite side, dorsal column sensation not affected. The fine touch, tactile localization, tactile discrimination, vibration, proprioception, stereognosis. Okay. Below the level of lesion, opposite side, motor changes, mild or no paralysis, crossed pyramidal fibers are affected. So opposite side, the motor changes are less than sensory changes. The same side below the level of lesion, motor changes are prominent than sensory changes, but the opposite side, sensory changes are more prominent than motor changes. So on the opposite side also, the motor changes is similar to the upper motor neuron lesion. At the level of lesion, same side, all the sensation lost because destruction at the level of lesion, destruction of the posterior nerve root, it lost all the sensation. The motor changes is similar to the lower motor neuron paralysis. It decreases the muscle tone. It is produces the plasticity. All reflexes lost, superficial and deep reflexes, everything is lost. In the opposite side at the level of lesion, the crossed spinothalamic tract is affected. So the pain, crude pain, temperature, crude touch is affected. Dorsal column pathway is not affected. So intact, fine touch, 2-point discrimination, tactile localization, stereognosis, proprioception, vibration sensations are intact. Mild or no motor changes. The motor changes are similar to the lower motor neuron paralysis. It is similar to the lower motor neuron lesion. Summary of the Brown sequard syndrome, otherwise called as the Hemi section of the spinal cord. It's occurred due to the injury or accident. Tumors affect the Hemi section of the spinal cord. So simply, if you write the same side below the level of lesion, dorsal column pathway is affected. Opposite side, spinothalamic tract is affected. Okay. So if you write these points, you can get the half marks. So in the elaborately, you can write everything. What happened in the same side, in the dorsal column pathway, spinothalamic tract, pyramidal tract, opposite side, what happened, at the level of lesion, what happened, everything you can write. If you not remember everything, simply you can write below the level of lesion, dorsal column pathway is affected. Opposite side, spinothalamic tract is affected. It is, you can get half marks. Okay. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.